All right, guys, welcome back to another episode with Dr. Trevor, Virtue Gap Physical Therapy. And today we're going to be talking about self-assess any sort of injury that you might run into in the weight room and being able to navigate those. That way you still have an effective workout. And with that, we'll dive right into it. First things first, I think let's talk about the weight room, talk about working out and all that. I think talking about some common things that we see and then how to navigate those, because obviously we can do it ourselves since we have the knowledge base. Like, it's super easy for us to modify, but being able to walk people through that's another skill set. So Trevor, why don't you talk about a few common things that you see and then how you navigate those?
Yeah, of course. So again, my name is Dr. Trevor Souik, physical therapist. I work with strength athletes, particularly powerlifters, a little bit of strongmen here and there. Things that I see that are really, really common are, the stiff, achy, cranky back. Shoulders are really common. Knees are probably third, but it's just that kind of general idea of people trying to figure out, am I just stiff? Do I just need to do a few more warm-up sets, a few more exercises? Did I hurt myself? Like, am I on the pathway to injury? Is this something that's fine? There's just kind of like a lot of confusion between, am I hurting myself? Is this a normal sensation? Did I already hurt myself? Can I keep laying on the gas? Do I need to pump the brakes? More or less, just there's a lot of confusion as to what's okay to train with, how we can modify things, and what's actually putting you on a path towards further harm or potentially even time off of gym or off of competition.
Yeah, I think that's a pretty big piece, is being able to comfortably self-assess and figure out if it's something that you need to stop immediately and go seek help, or if it's something like, okay, this is pretty run-of-the-mill stuff. This is typical with training. I just need to figure out a way to work around this for the time being and then get back to the normal stuff.
I see really, really commonly is more the kind of like, it's happened to everybody. You wake up, you're just a little sore, you're a little achy. There's a term that I've seen thrown around for this called like ischemic pain, which basically just means you haven't had a whole lot of blood flow to that area yet, so it's just going to be a little sensitive. So a really common thing that I see is this kind of, I'm going to use that term, ischemic pain, where it's just you aren't warmed up yet, so of course things feel a little rusty. Of course things feel a little bit off. So the first thing I'll say to people is, well, does it actually hurt or are you just cold? So if you go and do a warm-up set, let's just say you're doing like a back squat. If you do a warm-up set there and those first few reps just feel awful, every joint in your body cracks, it hurts a little bit, okay, fine, whatever. You're not going to injure yourself with a 45-pound bar, at least probably not. So first kind of guideline I give people is like, well, if you do a set of 10 or 15 with the bar and it gets better, like, does that happen? If it gets better, sweet. This is almost certainly a normal thing. You just need to get warm, right?
Yep.
Another option there is you can kind of break down that squat motion. If you're just like, hey, you know what? Like, I am really stiff this morning. I'm not even ready to get into a squat position. Okay, try something like hamstring curls, leg extensions, just to get yourself warm. Maybe you use a leg press as a warm up. Maybe you do a couple walking lunges, get on like an air bike, whatever it is. Just something to get systemically like your blood flowing as a whole. Think of it almost like priming a lawnmower. Sometimes you can get the thing just going right away, but other times you need to go over there and get the gas flowing a little bit.
Right, prime the motor a little bit.
Exactly. So you're literally priming a motor.
Right. With warming up, do you yourself get on the Stairmaster, the treadmill, the bike, or anything like that to globally warm up beforehand, or do you just kind of hop right into the weights and do lighter sets?
Me personally, as much as I hate doing it, I do like using the assault bike for even like 2 to 4 minutes before I actually get squatting, because it just makes me feel a little bit more fresh. It's kind of weird. Like, I even feel a little bit more focused, a little bit more cognitively like, okay, we're ramping up, we're doing something. But then in terms of like a warm-up routine, just because the people I work with, I'm working with power lifters, they're just not that complex of movements and people are pretty well established with them. I don't do a ton of specific warm-up exercises like for myself or for my clients unless they really need it. Like, I toss in specific stuff and I try to keep it to, I don't want to say a minimum, but it's just kind of like, what do you actually need here? Do we need a laundry list of 15 exercises to warm up, or can we get away with like 3?
Right.
But I do really like the idea of it can be as short as 2 minutes, 2 to 10 minutes of something to just get your body going.
I honestly hop on the treadmill for about 8 to 10 minutes and then put that on an incline to get a little more glute and hamstring activity. And then I have my routine of mobility stuff that I do before I even touch a weight or touch a bar. Because I think especially with my population, the getting in as many exercises as you can in that short amount of time, making your workout the most effective that you can. Like the warm up is a great time to work on some mobility things because that's only going to enhance your weight or resistance training performance too. And so you're getting a couple birds with one stone as far as improving mobility and enhancing your resistance training performance. So yeah, there's definitely like I think it's 4 or 5. I do the treadmill and 4 or 5 different movements for my hips and my back before I even touch a bar. And then once I go into that, then I feel pretty good.
I like that. And even like 4 or 5, like that's something you can probably do in like a circuit fashion. You can zip through it a little bit. I guess ultimately what my ultimate pet peeve is when people turn their warm up into a workout before their workout. Like it's a warm up. The whole purpose of a warm up is to, one, get your body temperature up. 2 is to build up to whatever your working weights are. And 3 is just generally get your body prepared to get into the positions that you need to. You check those 3 boxes, like, sweet, got it.
Right.
But that also shouldn't take you 45 minutes, especially if all you're doing is like a barbell back squat. It's just not that complex of a movement. You shouldn't need 45 minutes to be able to squat an empty bar.
Right.
But that's a whole other that's a whole other tangent I can go on.
There is a little science behind the warm up. Like you don't want to do the static stretching. You want to do the dynamic stuff. You want to increase that blood flow, like you said. You want to increase that tissue temperature and that tissue elasticity because that's how your performance is enhanced in the weight room. That's how your performance is enhanced for your cardio, for my people, and then in the field too. So a warm up is something that it's often overlooked, in my opinion, but it's something that you're definitely missing the boat as far as performance enhancement if you're not doing it.
And all that's to say that a good warm up can help you get rid of these like morning pains or these like, I just got to the gym and everything feels like crap sort of pains, right?
Exactly.
Like I understand like these sorts of feelings, like they're uncomfortable, but you're probably not, I don't want to say you're not in pain because pain is subjective and it's a matter of perspective, but like it's uncomfortable. It's not a pleasant sensation. It's not like if you went right into the gym and you just did a couple of air squats. It's not like you're like, oh, this feels really good. This is a pleasant sensation. It's probably a little bit of, oh, it's kind of a bummer. Right. I kind of don't like this. Maybe I should do a few things. Maybe I should break this down a little bit. Maybe I should get my core temperature going a little bit, right?
Yep.
And then all of a sudden you go back to a set of air squats or a set with an empty bar, whatever, and you feel totally normal. Great, carry on.
And the piece that you talked about with your joints cracking and popping, like every joint in your body, like that is totally normal. Nothing's out of place. It's sometimes, I mean, it can be a sign that the joint is actually healthy because you have synovial fluid. Might have air bubbles within that synovial fluid. Those are just popping and getting out of there. So you're not popping. Whenever you go to a physical therapist or a chiropractor too, no one's popping anything back into place. And that's a big pet peeve of mine. So when you hear the popping in the weight room, when you hear the popping when you're warming up, nothing's popping back into place. You're just getting that joint to glide and roll a little bit better than what it was. And sometimes there's adhesions that break loose because the joint was stiff because you haven't moved, like you said, that morning, or there's those air bubbles within that synovial fluid and getting those out of there. So the joint the cracking and popping is totally normal. It's a good thing. It means that things are moving around.
Totally normal. Something I'll say to people a lot of times in those situations, because super common question, but something I'll say is like, you have a lot of pieces of anatomy. They're going to touch each other and make some noise sometimes.
Yeah, that's a good way to say it.
Your body's not going to be silent. You're going to make noise.
The biggest thing is just move and see how it feels when you move. If it gets better after 10, 15, 20 reps, you're onto something. If it doesn't, stays the same, try it again, see what happens. And then if it still stays the same, if it's painful and not true, or if it's just more than discomfort, it truly is painful, then you might have to figure something else out. And that's what we're going to dive into.
Yeah. And I'm glad you said that, because like where I kind of draw the line here is if you start getting into like your warm-up sets, like this is part 2, like where things are actually starting to hurt a little bit and how to navigate that. So where we're going to try to go with this is, okay, so like I'm warmed up, like maybe I'm sweating a little bit. I went through my usual warm-up routine, but something is still hurts, right? So if you're at this point and something actually makes you want to say, ouch, that hurts, how do we navigate that? So number one, it's pretty normal, again, for you to have like these days, maybe these weeks, little periods of time where you'll get little issues here and there. You'll get a little bit of a ding. If we're going to stick with the example of a squat, it's not super uncommon for you to have a little bit of discomfort on the front aspect of your. So I think we've actually talked about this in the past, but some guidelines that I'll use in this case, now we're using the situation of you're warmed up, you're getting into your workout sets here, and you're not totally pain-free. Number one, that's not super abnormal. But let's say you actually go through your first set here. If your pain doesn't increase beyond where it is, you're probably doing okay, right?
Yep.
You're probably not going to damage yourself. You're probably not going down this pathway of, hey, we're breaking down tissues way too much, and you're not going to be able to recover from this, and you're just on a one-way ticket to injury, so to speak, right? Or Snap City, some people call it, right? So to say that again, like if you're warmed up, feeling pretty good, got a little bit of a sweat going on, temperature's warm, get to that first set. If you still get a little bit of that ping, a little bit of damage, a little bit of not damage, a little bit of a ding, a little bit of a pain sensation, but it does not increase throughout the set, and it doesn't increase during your work, or your rest rather, or it can actually go down during your rest, you're probably in a good spot to just do your second set. Where I would start asking questions, and maybe we want to back off a little bit, is if your pain levels do increase as you do more reps. Like, for example, again, squat, if you say we're going to do a set of 6, let's say reps 1, 2, and 3 are totally okay, and then we get to 4, 5, and 6, and you're like, okay, I really didn't want to do reps 4, 5, and 6 because it started to hurt even worse. It started to be more like a jabbing, stabbing type of pain. It made me want to move differently. I didn't want to put weight on that leg. I was starting to lose my confidence. I was getting in my head. If we're at that point, this is when we want to start making some adjustments here. And again, I want to illustrate this too. Like, if that happens, again, it doesn't necessarily mean that you're going down this destructive path of, okay, I did 3 too many reps, and now I'm going to tear my patellar tendon off of my leg.
Right.
Like,
it's not the case.
We're not trying to say that narrative here. Like, what we're trying to do is really alter your body's perception of pain.
Right. Because pain is an experience, right? Pain is not an input to the brain; it's an output from the brain. So the brain interprets the signals that are sent back to it, and then it decides, is this dangerous or not? If it is, it's going to send those pain signals, right? And the varying pain intensity is dependent on the brain's interpretation of those signals and the varying threat, right? If it's a higher threat, it's going to send greater pain signals, so that way you get the heck out of there. Whatever it is that you're doing, situation or movement, position, whatever, you're going to get out of that situation and into something else. And one thing, like, we're talking about pain, but this can go with any symptom, right? Someone might have low back issues going on to where they don't have any pain, but they have some sort of numbness or tingling somewhere, right? So if you're going through your set or your cardio workout or your mobility workout, right? If you're going through your workout and your symptoms don't increase from baseline during or after, you're in a great spot. Like, that is a perfect amount. If you're going through your set or your workout and your symptoms increase a little bit, usually I say 0 or 1 to 2 points in a 10-point scale, right? You have a 0 to 10 scale, 0 no pain, 10 you're going to the ER right now. If your symptoms increase 2 points on that 10-point scale from your baseline from when you started that set, that's a sign that, all right, like, that's the top end that you want to increase. Anything above that, it's time to stop and modify. But what that increase in pain, and I'm guessing you're along the same lines, is that's a sign that you're loading the tissues, right? And sometimes the tissue might be a little too much. It's a little trial and error. Trial and error. It's like, let's try this weight, let's try this dose, see what happens, and back off or increase if we can, right? It's not, we try not to make it rocket science, but we need to be methodical about it and tactful about it.
Yeah, I'm glad you brought up that scale of like the 0 to 1, sometimes 2 points on your 0 to 10 scale. And I think it's a good point to bring up too, that we're not trying to make all exercise pain-free all the time. 1, that's impossible. 2, like, experiencing pain is a normal thing, but we're just trying to decide, is this something that we can kind of power through without hurting ourselves, or are we, letting our egos win and doing the whole no pain, no gain thing here?
Yeah.
I think it's really important to illustrate, like, in these cases, if you're getting a little bit of that ping, if you're getting some of that pain or discomfort, it's really important to know that, 1, it's probably going to clear up in something like 2 to 6 weeks without doing any special kind of intervention to it. On top of that, at some point, you're going to have to lean into that discomfort a little bit. But again, that's not to say no pain, no gain. I'm just here to make it hurt, and that's what makes it heal. That's Not
Right.
really the case. But at the same time, we want to rebuild these tissues, want to build their aerobic capacity, we want to build their strength, their mobility, their elasticity, all these different qualities of it. You're going to have to lean into that discomfort at some point a little bit, recover from it, and then build back up into it.
Right.
Yeah, that pain threshold should get further and further away. Like you should have to work harder and harder to get to that.
Right. And you brought up a great point, like the discomfort versus pain, right? Like some of those stats, like if you're training in hypertrophy or if you're even doing endurance training with weights, you're going to have discomfort. Like that is inevitable. Those higher reps suck. And so you're going to have to be able to delineate between discomfort and true pain, right? Like discomfort or your symptoms, right? Like being able to decide what is going on here and asking yourself and taking a second during the set to figure that out too, especially if you're going into the workout with a little nick or a little ding. Again, you have to be tactful about it. Increasing your symptoms is not bad. It's okay to do as long as you're doing it in a controlled fashion and you're backing off when you need to back off. Again, you're stressing the tissue to make it adapt, and then when it adapts, it's going to be better than what it was before, and then that's how you get better.
Yes, and that's where people like you and I come into play. Is like we're going to agree upon some kind of threshold, like how much symptom increase is okay and for how long, right? Like even if during a workout you get a little bit of that, I was at like, maybe +2 on my pain. But if it takes you 4 days to recover from that, okay, +2 is not okay for you. Maybe you're only allowed to do +1, right? So like that's the other part of it. Like generally speaking, if you're coming in with like that consistent nick or that consistent ding on the same movement, same spot of your body, whatever it may be, I generally tell people like we want to run like about a 24-hour cycle here. Like you can be elevated a little bit, but within 24 hours, you should be back to baseline. I don't want you spending 3 days recovering from, flaring up this little ding in your knee.
And again, this is with someone coming into a workout with a true injury, right? This is not someone coming in fresh, feeling good, or I guess someone who experiences some sort of pain or some sort of symptom during the workout too. If you're feeling fresh and you're going into a workout without any sort of concerns, then you might be sore for 2 days, right?
Yeah.
Or that 2 to 3 days, that delayed onset muscle soreness DOMS. For me, I'm a 2-dayer. It doesn't hit me with day 1, it hits me day 2. Like day 2 is peak, and then day 3 and sometimes even day 4, like I'm still a little sore, depending on how long it's been since I've hit like a heavy weight training session. So being mindful of that, like that is discomfort though, again, that's not my symptoms, right? So delineating between your symptoms and discomfort is important as far as your response to the training goes as well.
Yeah, I think a really easy way for people to digest that is just because it's very easy to make very brutal. Let's say you're on like a leg press because it's very easy to push very hard. After a set, are we talking like, hey, my legs are exercise sore, or are you like, ouch, that thing I've been complaining about is flared up? Like, where are we on this spectrum?
Right.
If you're just like, hey, my quads are really pumped and really full of fluid, and if I stand up, I might fall over. You're fine. You're not fine, but you're fine. That's a lot different. That's a lot different than like, ouch, like that pain on the front of my knee is like through the roof now. That's just, again, exercise versus ouch. Like this makes you want to say, ouch, this hurts, right?
Say that happens during your workout. Like, what do you recommend for someone to do to obviously, like you drove to the gym, you went to the gym, or it's at home, right? You got home from work and you went to your home gym, or you got up super early, you went to your home gym. You don't want that wasted time. What do you typically recommend for someone like if they're experiencing their symptoms and increasing their symptoms that is not an acceptable amount? What do you typically recommend that they do?
Ooh, I like this. So what I will usually do is I have like kind of 3 check boxes that somebody should be able to try to hit, or like not necessarily try to hit, but there's 3 different ways to go with this. Like one is that you can just change the load you're using. So let's just say you get up to a certain amount of weight on whatever exercise it is, and that starts to bring out your symptoms. You're probably like, that's probably one of your triggers is you just get to a certain intensity or a certain amount of weight on the bar, or a certain heaviness of a dumbbell. Honestly, just back off. Super, super simple. Like I think that's just kind of like the no-brainer one. It's hard to give kind of some kind of specific recommendations for that, but honestly, I would keep it as close to your regular training as you can. Honestly, sometimes going as close to 10 to 15% off is plenty. So for example, if you were lifting 100 pounds, now you just go 85 to 90. You're going to get almost the exact same training stimulus using 90 pounds as you will 100. But if the difference is between you getting that workout in and not getting that workout in, now it's not even a comparison. So number one is like check the intensity of the exercise, like how hard are you going? Number two is positional. So this is usually when people are like, yeah,
Time out.
Yeah.
Let's go back. So
Sorry.
say someone does that, like they were squatting 100 pounds, they have to back it off to 85 pounds. And their dose that day was 4 sets of 6, or let's go 4 sets of 5. Okay, so now they do 90 pounds. Like, this feels great. I'm gonna do like, I know it's supposed to do 4 sets of 5, but I'm gonna do 4 sets of 8 because this feels good. This is lighter weight. Like, I can rock it. Like, what do you recommend? Do you stay at that 4 sets of 5, or are you cool with them going up to 4 sets of 8?
I generally will have people just keep the exact same volume, and volume just meaning sets and reps in this case. If you want to get a little tricky and like slow down your reps or something, or add a little pause, I'm usually fine with that because that's not adding any like extra sets or reps, and it's not adding any weight. You're just kind of moving in a way that's making it, the movement itself, more challenging. But like I said, like on a day-to-day basis, I would just rather have you hit that normal 3 sets of 6. I think that's what you said, 3 sets of 6. But if you had to take 10 or 15 pounds off, that's the answer. Like, we're already playing a little bit of a weird game. Like, we don't know how your body's going to respond, just being loaded and in pain. So let's only change one variable. Let's not like,
Exactly.
Hey, we're going to do an extra set with 3 extra reps, and we're going to take 10 pounds off, because then 3 days later, you're like, well, did it work? I don't know. I don't know which part of that worked.
I just changed so many different things. Right.
We changed 4 variables, and they all interact with each other.
Right.
But long story short, or long answer short, however you want to say that, I would just do the exact same thing. Same sets, same reps. Keep it there.
You just
take 10 pounds off if you need to.
Yep. Perfect.
That's all I do.
I like it. All right. What was your second point?
Second part is positional. So this is when a lot of times people will say like, hey, my knee hurts when I squat. And you go, well, does it hurt throughout the entire motion? Does it hurt when you get to a certain spot? And a lot of times it's like right when people get to about parallel, sometimes deeper, like give or take there. So it only hurts when they're there. When they're not in that position, they're out of it. As kind of obvious as it sounds, avoid that position. Get as close to it as you can, and then more or less just don't spend a whole lot of time there. Other options, really, really simple ones I like, are actually just slowing down your tempo, which will require you to also reduce weight. So now we're getting kind of violating what we just talked about, where we're changing a couple of variables. But if it's really important for you to get into a certain position or a certain depth, like for example, my clientele, powerlifters, you have to squat to parallel for it to count in competition, and everybody's obsessed with squat depth, all this type of stuff. So if it's really important for you to get to that position, but it hurts, this is where I'll do things. I'll add like some kind of, I'll change up the environment. Like I'll have them squat to a pin where the bar will actually purposely go onto the safety pins, or I'll have them squat to a box just at that position. I'll have them slow down the tempo, or I'll have them pause like right about that position. Because we do also know that like eccentrics and isometrics can actually somehow change people's pain perception a little bit, and just to see how that responds. But for the most part, on like a 1-day basis, I'll have people temporarily like just avoid or reduce the amount of time spent in that position.
Eventually the end goal is to get them into that position, as long as it's a safe position to be in, as long as it's not some funky weird position that's going to will take the knee, put their knee at some sort of compromised position that when 300 pounds is on their back or 350 pounds is on their back, like, yeah, no shit, you're going to have pain. Like no matter what you do, you're going to have pain because your knee is in some sort of wild position. So yeah, it's a temporary, reduce the range of motion that you're working through, reduce the working range of motion, and then work back into it once things are starting to subside.
Yeah, and again, just to recap, like in this case, we're talking about on like a day-to-day basis. Like you go to the gym Monday morning and you're just like, I'm just not feeling it. This is just my body just feeling cranky today. We're not talking about like injury, not yet at least. We're not talking about injuries that are like, hey, this has been kind of nagging me for the last like month or two, right? We're kind of talking like we're adjusting on like today. Like we came in with a plan. Plan's not going to go according to plan because body's not feeling it today.
Yep.
At least that's what we're talking about now.
Yep. And this is, I mean, this is directly applicable to hunters, like to hiking, to hikers, anybody, backpackers, because you could come off the mountain on, like, we're in season now, like elk season's in full swing. We got mule deer season going on. Everybody's out with archery stuff. And say someone's up there on the weekend, and then they live in the area, they're weekend warriors, they get after it on the weekends, and then they go back to their 9 to 5 during the week. They work out a little bit during the week, and then they go back up to the mountain. They get hurt they twist their ankle or do something funky to their knee or their ankle, and they're like, well, I'm not going to work out this week. Like, that is the exact opposite of what you should do. Go to
Yes.
the gym, do your workouts, modify them, right?
Mhm.
Modify the range of motion, modify the loading, the dose, the weight,
Mhm.
however you want to look at it, modify the weight. And then you have a third point too that we're going to talk about. But yeah, modify those two things. Like, still go, because you still need to load it, because that is going to help you through that injury.
Exactly. Yeah. And that's another big point is it's not take time off and let it rest. Like rest needs to be a little bit more dynamic, and really you need to load to actually stimulate tissues to actually grow. I mean, very much the
Right.
same way that like, hey, if you want to grow muscle, you have to work it to make it grow. Injury is the exact same thing. Like if you want like your tendon to regrow, you do have to load it. It's just a little bit more of a balance of how much load versus how much rest, right? So it's not
Exactly.
total
You got to be
rest, but
able,
it might be you might have more of like 1 day of work and 6 days of rest as opposed to 2 days of work and 5 days of rest, something along those lines.
right.
But that actually kind of segues into like what my third point would be is like it's kind of just a combination of volume and frequency, which is kind of the same thing. Like, for example, if working legs is something that you typically do twice a week, powerlifters is super common. I'm sure outdoor athletes also super common because you're hiking and rucking for days.
Right.
I'm sure that's super common. Just generally speaking, like if it hurts, like if it starts to bother you as you do more and more work. So again, just keeping with like the squat and the knee example, let's say like on paper today you've got 4 sets of 6. Let's say you do 2 sets and you're like, okay, we're feeling okay. We're maybe we're a little dinged up, but we're still within that 1 to 2 points increase on your 0 to 10 scale. During rest periods, it decreases a little bit. But let's say you do set 3 and now all of a sudden you're like +5 and you didn't add any weight, you didn't add any reps. It's just another set, right? But now you've kind of violated that threshold of going up 1 or 2 points. At that point, if you're kind of violating that, I would do one of two things. Either kind of go back to number one and take some weight off the bar, or probably even better yet, considering it seems to be more like the total workload beats you up, I probably wouldn't even do that 4th set at that point, especially if you start to violate that rule.
Right.
Because at that point, if you are getting to that point where you're violating it, even if it starts to come down during rest, you're either one of two things is going to happen. Either it's not going to come back down to baseline, or it will come down to baseline. You'll just be super sensitive for this next one. Because a lot of times people in this situation that I find, they get a little bit increasingly sensitive, where it's like you kind of cross this threshold, and even if you recover from it, if you give the body that stimulus again, all of a sudden it's like off the charts, right? So
Yep.
at least in my experience, that's kind of what's happened, where you kind of get like 1 set where you can kind of push the boundaries a little bit too far, but 2 sets, all of a sudden it's like, yeah, man, we did too much. Now I'm sore for 4 days. Like that's not what we want to do. But
Right.
more or less, like we said, that rule that we were giving you earlier, where it's like, if you're staying within like 1 or 2 points on your own 0 to 10 scale, you're probably fine. But once you violate that's probably your last set, at least on that exercise. It might be your last set for that muscle group. Like again, if we're saying, let's say you're working your quadriceps, right? Let's say you're gonna do squats and leg extensions. Maybe you get to like a 5th total set, and it's just like, okay, now it's starting to beat you up. I would just leave your total volume there, because again, it's kind of the gains versus forget like what am I looking? What's the risk versus reward? That's what I'm looking for. It's kind of like risk versus reward at this time. If you've already gotten 3 or 4 really good sets in, you're going to grow. You're going to move towards your goals. But if you try to add in 3 or 4 more sets, it might actually like detract from what you already done. Because if you get to this point then where now you're going to recover for 5 days because your knee's just been bothering you, like we're not actually using our recovery sources to build bigger, stronger muscles. We're just looking to like kind of maintain what we used to be, right?
Right.
And it's not to say, oh, hey, you should just quit and go home now. But it's more like, I think that's enough. That's the proper dose. Like that's enough stimulus for this movement or this exercise right now.
Right. Right. And then move on to your next exercise. If you're training,
Yeah, exactly.
our splits, like for my population, looks a little different than what your splits are, but go on to your next few exercises and see how it goes. And if you have to modify those, modify them. If you find yourself modifying everything though, you're probably at a point where the tissue's had enough for that day. It's time to just pack up your bags and head on home. Because again, like what you had talked about, and I'll use the poking the bear analogy. Like you poke the
Yeah.
bear once and it's like it kind of barks at you, right? Like mama bear. She barks at you like, hey, knock it off. and then you stop, and then you wait 15, 20 minutes. You're like, I'm gonna freaking go for it again, right? Like we're gonna see what we can get away with mom. And you poke her again, and she flips out, and she's pissed, and she's gonna stay pissed for a little bit. And like you're gonna go to your timeout in your room or whatever, however old you are. Put your nose in the corner. That's what my parents had us do. We put our nose in the freaking eye. Don't understand it, but whatever. It just depends on the reactivity of the tissue and how it's reacting to the stimulus that you're providing to it. If it continues to get aggravated with each set, it's a sign that you probably, you've hit your load or your load limit for the day. Go, I don't know, go home. Yeah, drink your protein shake and head on home then.
Yeah, yeah. And again, this isn't to say like, oh, you have to give up and quit now. It's more of like, hey, we went in, we did what we could, we listened to our bodies, like we're going to get better because of this. We're not going to do the whole 1 step forward, 2 steps back because, well, I have this workout written down on paper and I have to do it as is. It's like this workout written down on paper is assuming that your body is acting as we expect it to. Like this is assuming that you're not hurt, you're not dinged up, but that no longer applies, right? So now the objective is to do the closest thing to that you can get away with without needing 4 days of pain recovery. Or 2 days or 3 days.
Something to be mindful of too is with folks like engineers, for example, who are very number driven, not getting caught up in adding up the volumes. Like, oh, okay, like I did this weight for this many sets and reps, and so this was my total volume. So, and this is where I had symptoms. So we'll see. It's like, nah, man. Like every there's so much that goes into your body's recovery, your sleep, your nutrition, your hydration, your prior workout, your stress levels, like what's going on at work, what's going on at home. There's so many different aspects that go into someone's performance that you can't get caught up in the numbers that much. It's good to keep track. Like you got to keep track of your stuff, right? But try not to get so caught up in them that you're calculating it. Okay, this is when I experienced this, and this is when I experienced that at that volume. That's a rabbit hole just to fester. And that's a whole nother brain game as far as the pain experience goes.
Yeah, powerlifters are awful with that. Like, hit 400 pounds last week. I have to hit 405 this week. Like, not if your back's not telling you. No, like, I'm like, you're doing a different variation this week. Like, we'll find a way to make something hard. Like, you're not doing a top single this week. You're not doing a top one rep. No.
Honestly, there's probably, and this goes into the mobility work too, like there's likely a reason why, if it's not positional, right? If it's not some sort of exercise technique fault, there's likely a reason why you're experiencing your symptoms. So working on, people will call it the rehab stuff, but it's really not rehab stuff. Like healthy individuals are likely doing that anyway. And that's why they're staying relatively injury free. But working on your mobility, working on some balance control, that's going to help. You'll still get a workout. It's a different type of workout, but you're still going to add to your workout. It's going to enhance performance, and hopefully get you recovering a little bit quicker too. If your workout is not the volume that it's like where it used to be, and you feel like you got to do a little bit more, great time to work on mobility.
Yeah, and I think another really important thing to toss in there too, at least for like my population, like you've already talked a little bit about, like you incorporate a lot of movement variability because outdoor athletes have a lot of variability. Powerlifters like the exact opposite. Like there's like actually in a weird way, like minimal variability is actually kind of a good thing, but that's a whole other tangent rant here. But a lot of times when I have people who have back pain, it's like I actually start to finally throw in a little bit of transverse and frontal plane movement. I'll have them like carries, things that just aren't squats and deadlifts, just changing up the stimulus. And you can find in those cases too, it's like you can still train your back and your trunk really hard. It's just going to be different. Like we're still going to have you squat and deadlift to some extent because it's your sport, you have to. But like we might put that a little bit on the back burner as we change up your training volume, or like a little bit of like how you're training your spine, because spines do more than flex and extend.
Yeah, they side bend and rotate, so you got to be able to do that and not have. Yeah, you can't have pain while you do that stuff too. And again, being smart with your training, but training in those different positions is super important. Sport specific training. And Jason Rowe, when I went back to the NSCA Wisconsin conference, I went to Jason Rowe's lecture, and shout out to that guy. Like that dude said, like awesome exercise science professor at Carroll University. Anybody listening to this, like take his classes if you're going to Carroll.
I'm going to tag him in this.
Right. And he talked about sports specific training is really introducing the body to as many different variables as possible. So you're not even really doing your sport specific stuff. Like as far as your training systems go, yeah, you're going to do sport specific stuff, right? But as far as like the movements and all that, like you want to introduce the body to so many different movements that if you get in that position during that sport, for my people, it's out in the outdoors, and you can be some wild positions crossing a creek or
Hmm.
crossing deadfall, right? So training the body in all these different positions, so that way if you do get there, it's not, hopefully it's not your first time in that position, or if it is, you were introduced to a position, or yeah, a position very similar to that, to where your body can respond pretty quickly and you can avoid injury. That's my whole training premise, is trying to, like, I don't have people ruck. I don't recommend rucking at all. And because you, like, that is our sport, right? That is our event.
Hmm.
You don't see NBA players, you don't see NFL players practicing at game speed every single practice, or even
Yep.
all the time, right? Especially football now with the CTE stuff coming out.
Yeah.
So introducing the body to get you ready for rucking in as many different ways as possible is super important, because you're going to run into fewer overuse injuries, because again, you're introducing those different stimulus that's going to continue to force your body to adapt, and you're going to run into plateauing less, like all these different things that people run into. You run into it because you're not changing up your training.
A couple of my favorite examples in my realm, just powerlifting, strength. We'll just say strength training in general. You'll like this one. The Jefferson curl. For those of you who don't know what a Jefferson curl is, take everything you've ever learned about a deadlift and throw it away. So it's keeping your legs straight, and you're just going to purposely bend your entire spine with a little bit of load and then stand back up. For those of you who
And
don't know,
a
that
huge
is one
key,
of my favorites for back
it's,
rehab.
yeah, it's super
Like,
good for back,
people are like,
but
but it's a round back. I'm like, uh-huh. I know. And we're training it with 45 pounds to start. Like,
we're
for
not doing
example.
it. Yeah,
Yeah.
you're not doing it with a heavy load. Like I had
Yeah.
someone start with 15 pounds. It's like, start with
Yeah.
15 pounds and see what that does. You're really
Yeah.
just using that weight to help your back bend forward, and then you have a little bit of load when you bend it back up.
Mm-hmm. Yep. And then kind of on, I guess the opposite end of the spectrum is doing back extensions on like the 45-degree extension. So not that like when you're squatting and deadlifting, you're not actually in this big extension position, but it can happen when you on rack weights. But it's like we're just training your spine in different ways. But it's Jefferson deadlift or Jefferson curl, one of my favorites. One of my
Yep.
favorites for low back rehab, because it kind of messes with people's brains, but at the same time, it's like if you're squatting in like the 1 to 3, squatting or deadlifting in like the 1 to 3 range, and the bar just starts to beat you, like you're gonna get put into a little bit of that rounded position. Now that's the goal, but again, we're preparing for like worst case scenario, right? It's like if you do start to fail, are you going to be resilient and strong enough to actually beat this weight? No. Are you going to be able to
Exactly.
hold that position without snapping in half, right?
Rock on. All right, man. Was there anything
Yeah.
else you wanted to cover?
No, as I said, I think we covered everything we wanted to cover. Pretty much all the what to do if things are achy, and how to decide how to do things.
Clinical bottom line. What do you have?
Pain is normal. If you wake up and your body is disagreeing with you, tell it to be quiet, and kind of tell it to be quiet, and still get some kind of workouts, get some kind of exercise, because that's always going to move the needle forward. A full day of rest is a time and a place, but simply resting for a day or a week or a month is not going to help you recondition or prepare your body.
Yep.
So more or less, keep on track with your goals. Just one day at a time. You're just going to have to take a little bit of a detour. You can still get to your destination.
Yep, exactly. Yeah, that'd be mine. Like pain, discomfort, it's normal with life. Being able to modify and adapt according to what you're experiencing, and having the knowledge in order to do that, that's super important. But like you said, you've got to still do something, and being tactful with that to progress and then get back to normal is the important thing.
Yeah, doing nothing might feel good, but there's a difference between feeling good and having tissues that are actually prepared to do what you want to do.
Exactly. Yeah, especially with the level of athletes that we're working with. So
yes.
Right on, man. All right. Well, that'll do it. Thanks everyone for tuning in, and then we'll catch you guys on the next episode.